वेलकम बैक नाजरीन। पहले हाफ ऑफ द प्रोग्राम हम डिस्कस कर रहे थे मेंटल कैपेसिटी एक्ट। इस हाफ में भी हम थोड़ा सा और ज़्यादा डिस्कस करेंगे मेंटल कैपेसिटी एक्ट के बारे में, लेकिन अपने स्टूडियो गेस्ट की तरफ जाने से पहले चलते हैं हम एक छोटे से वीडियो क्लिप के बारे में जो हमें और मेंटल कैपेसिटी एक्ट के बारे में बताएगा और एक पेशेंट की एक पर्सनल जर्नी और पर्सनल एक्सपीरियंस है। चलते हैं इस वीडियो क्लिप की तरफ।
I was born in Liverpool way back many years ago. I went to a normal school, secondary bottom, left school at 15, went to work for Liverpool City Council as an office junior. Then when I was 18 I transferred over to the buses because it was a lot more money. I became a conductor first, and when I was 21 I became a bus driver. When I was 23 I was offered a job as making copper tubing, which I did for 4 years. The firm went bust. Tried one or two other small jobs. Got myself on a disabled course for industrial electronics. Moved to Birmingham because I got a house and a job. With the job, brought a wife and 2 children, Andrew and Carl. I've been here since 1979. I suffer from muscular dystrophy, which in turn has led to me having a few other problems. The main one being high blood pressure, returning fluid on the lungs, which causes me to cough a great deal, especially at night time when the lake flat on my back. I have got very limited use of my wrists, down to my fingertips. The arms and the legs no longer function. I cannot lift my hands to my belt, so I need all the personal care that you do for yourself. I need to be done for me. That includes getting up, toileting, bathing, feeding, dressing, sitting in my wheelchair. Then I'm fully mobile once I'm sat in a wheelchair. The memory is affected as well because once you get short of oxygen and you forget some of the simple things, it's like a minor attack of dementia. You remember things from the past, but I can't remember what I had for tea last night. I've been like this now since 1992 and got used to it. Don't like it. Still get really frustrated at times when I think I'll do something and I can't because I sort of remember I can no longer got the dexterity and the strength to do that. It would all started off back when I was 28, when I was originally diagnosed with the disease. I was backwards and forwards to hospitals for tests. I was in hospital suffering from a real serious bout of pneumonia, and I was just coming out of the field, the misty field that you are in when you've been pumped full of antibiotics, penicillin, drips, etc, etc, etc. And when he asked me the question first, I said to him, and how long ago? Are we talking of days, weeks, months, or years? And I said, I don't want to know. I said, I'm already frightened of what it is. I said, I do not wish to continue with this conversation. Anyway, the wife came in the afternoon, night time, and the consultant had a word with the wife. And she had a word with me because it was a bit more relaxed with the wife. And we agreed to talk to the consultant a couple of days later when I was a bit wrong with it. But I would strongly suggest that that was totally the wrong time. It was just while he was doing his rounds, so we never went to a private room or anything like that. And I do not like those sorts of conversations with just the curtain closed. I was a bit apprehensive because, strangely as it may seem, it's a life-changing decision. You only get to do it once, and if you get it wrong, there's no return guarantee. You've got to make sure that the patient is fully compensated, wide awake, not inhibited with drugs or anything like so. Have an advocate or a member of the family with them, because it is a decision that needs witnessing, so that the doctor can't be accused of making up his own answers. We text the hospital and we text the patient. So it really needs to take some time to consider how you do it.
नाज़रीन, ये था एक छोटा सा video clip. Martin, a very interesting video clip about a patient's personal journey in terms of the Mental Capacity Act. Can you tell me a bit more about this video clip?
Yeah, first of all, we're really grateful to Bernie for kindly sharing his personal story, as there's so much we can learn from our patients' experience and what's important to them and how they want to be treated rather than us imposing how we think people want to be treated. So I think Bernie was interesting where he was talking about how there are times when he struggles to get enough oxygen because of his breathing difficulties, and this can have an effect on his capacity because he then finds it more difficult to concentrate and to remember things. And Bernie's experience of being in hospital and having a difficult conversation about his health really tells us a lot about how we should approach those kind of conversations. Bernie talks about his capacity and his ability to have that conversation being more impaired at first, as he was just coming round from the effects of medication, and he felt he needed more time to recover before he could have that conversation that was about important decisions in his health. And he told us as well that it was really important to him to have the support of his wife, that he didn't want to have that conversation with the doctor on his own. So for him it was really important to have that emotional support of his wife so that she could be involved in that decision and she could support him with it as well. And Bernie also talked about the environmental factors as well of where the conversation took place, and it made him feel quite uncomfortable that he was having a conversation about a difficult health choice on an open ward and the only privacy was the curtain that was closed around him. So he was a bit self-conscious of that, and it didn't make him feel that that was the right place to have that conversation and for him to sort of talk about that really personal and sensitive information. So Bernie's story tells us what we need to consider, and having the conversation at the right time, using simple language, involving the person's family if that's what they want, and considering the dignity and the comfort of the person, as well as what worries them about the decision as well. There were certain things that Bernie really wanted support and reassurance about, and that was important that he got that support and reassurance from the doctor as well. And this all relates to one of the principles that underpin the Mental Capacity Act, and that's we have an obligation to provide our patients with the support that they need in order to be able to make that decision for themselves. And Bernie was shaping how he wanted to be supported so that he could make that decision for himself. And
Bernie's that video clip was absolutely fantastic and really powerful.
Yes.
and it's a really good example of when things work really well.
Yeah.
However, some people may say that the Mental Capacity Act takes away people's liberty,
Yeah.
and it deprives them of making those decisions.
Yeah.
And we would hope that that's not the case, and all proper procedures are followed,
Yeah.
and actually the patient is at the core of the decision making, and it is the patient's best interest.
Yeah.
But what would you say to that? Because it could be a possibility that people do think that, or the patient themselves may think, well, actually, I don't think this is the right decision for me.
That's a really good question, and when we make decisions on behalf of someone who lacks capacity, it's actually a balance. We make those decisions in their best interest, but you have to act in a way that's the less restrictive of their rights and their freedoms. As we said earlier, when we make a decision on behalf of our patients, we've taken away a small piece of their personal autonomy, because they're no longer in charge of that decision for themselves. And you know, if you were say to me that I could only have in my life because you've allowed me to have those things, I would of course, you know, challenge you and think, well, who are you to tell me what I can and can't have in my life? And we shouldn't expect our patients to be any different. So sometimes the least restrictive option is making no decision at all. If we can avoid making a decision, then we don't exercise any control over that person. But obviously there are a lot of times when in the NHS and in the local authority as well, that we have to make decisions on behalf of someone who lacks capacity, because if we didn't, they might come to harm, and we've got a duty of care to care for that person and keep them free from harm. Not completely free from any risk, because life without risk might be quite boring and quite dull. So we need to find that balance between their interests and their rights as well. So it might be that we make no decision at all, but if we have to make a decision, it might be that we act in accordance with their views and take their views very seriously. It might be as well that we need to consider any specific religious or spiritual beliefs that the person has as well, because they can have a significant bearing on the decision as well, because there are certain religious beliefs that have very strong views about certain medical treatments, and they would not want those treatments to be given under any circumstances. And again, those people who have those beliefs usually write an advance decision so that decision can be respected, even if their life were in danger, because that decision is so important to them as well. So it's about finding that balance between their rights and their interests. Now, there isn't necessarily a requirement, but one way of best practice under the Mental Capacity Act, if it's a very serious or a major decision, is to have a best interest meeting. And in that meeting, the person who lacks capacity, their family, their friends, or if they haven't got any family and friends, an advocate, and as well as the person making the decision and perhaps other professionals, all sit round the same table. They talk about the decision, what's important to the person, and they try and reach consensus so that everybody agrees with that decision, so that everybody's happy to take that forward. There might, however, be some instances when we do make decisions that go against a person's wishes, and that can be quite a serious thing as well. And if that is a really serious decision, as we said before the break, that if it's a very serious decision and that person disagrees with that, that might have to go to the Court of Protection, such as in that example where a lady's had an amputation against her wishes because she didn't understand the decision and her life would have been at risk. So even though she's got the right to make her own choices, she's also got the right to life as well. So the court had to try and balance those opposing rights there, because sometimes our rights might, even though they're our own rights, they might compete with each other as much as different people's views might compete with each other as well.
यास्मीन, मैं आपसे पूछ सकती हूँ, ये मार्टी ने हमें बताया कि एक्चुअली ये काफ़ी डिफ़िकल्ट डिसीजन हो सकता है जो मेंटल कैपेसिटी एक्ट के बारे में किसी को ये डिसीजन मेक करना कि having their right taken away or somebody else making that decision. लेकिन in the first half of the program आपने mention किया था कुछ illnesses जैसे कि dementia, learning disabilities. अगर हमारे कुछ नाज़रीन ये प्रोग्राम देख रहे हैं तो maybe they have dementia, they have learning disabilities, और अब उनको ये सोच है कि maybe we might be in a place sometime in the future that this may have an impact on us. आप उनको क्या कहेंगी? What will be your suggestions in terms of if they are worried about that?
हाँ, so मेरा suggestion होगा कि हाँ, go and see your GP as the first point of call to discuss the condition and the likelihood of perhaps reaching that position कि खुद न खास्ता उस place में होंगे कि decision नहीं बना सकते हैं और so फिर GP से मालूम होगा कम से कम about the medical side of things and the likelihood और फिर then it becomes slightly legal, which I think Martin ज़्यादा बेहतर बता सकते हैं मेरे से.
और आप मुझे ये बता सकते हो कि as a GP you'll of course know your patients and you will know that maybe their illness may deteriorate. So for example, there is some illnesses that जो बंदे को पता है कि आहिस्ता आहिस्ता ये deteriorate हो जाएंगे and ये उस point तक पहुंच सकेंगे कि maybe they will lack capacity. उस situation में आपका क्या role है? आप बताते हैं कि actually अपने patient को कि maybe in the future आपकी ये condition worse हो जाए और आपको ये जो act है you know it may be something that you need to think about now?
जी usually dementia is the commonest, वो सबसे common है कि उसके बारे में जब diagnosis बनता है usually hospital भी refer करते हैं for the specialist advice और वो भी बताएंगे और हम भी suggest करेंगे as a GP कि think about this for the future. लेकिन depend भी होता है कि who's around you, अपने friends and families is quite an emotional subject और अगर आदमी already बीमार है, you know, they're not feeling up to it, so we do encourage involving family and friends. सबसे जितने लोग से बात कर सकते हैं कि everybody think about that day पहले से and then think about what you want to do.
Okay, so in terms of that's the clinical aspect, and then I suppose Martin, it will be your side that comes in for the legal aspect of kind of making the decisions. And this you mentioned it seems like a bit about making a will.
Yeah, a lasting power of attorney is a legal document that gives, when you nominate another person that you trust, to be able to make decisions on your behalf. And there are two different types of lasting power of attorney. One's in relation to health and welfare, so it allows you then to make decisions on behalf of the person who lacks capacity around their health and welfare. It might be that you consent to medical treatment on their behalf. It might be that you can make then decisions about where the person lives and what activities and support they have. The other type of power of attorney is around property and affairs, so that's when we might need to manage someone else's money on their behalf because they lack capacity. So if we wanted to nominate someone we trusted in order for them to be able to make those decisions on their behalf, we do have to plan ahead for that, because we have to have capacity around that specific decision to nominate someone as our attorney. So then any lasting power of attorney has to be registered with the administrative arm of the Court of Protection, which is called the Office of the Public Guardian. If a lasting power of attorney is not registered with the Office of the Public Guardian, it's simply not valid and,
so it's void.
Cannot be used.
Okay.
Yeah, it just cannot be used as well. So it's important that people do register these documents correctly if they do wish to use them, because the difficult thing is that if someone already lacks capacity to nominate a power of attorney, then they cannot then nominate the power of attorney. But that doesn't necessarily mean that they're going to be disadvantaged as well, because as we talked about, there are a lot of safeguards in the processes around the Mental Capacity Act. So just because a family member doesn't have that decision-making authority doesn't mean they're excluded from the decision. It doesn't mean that they will be won't still have a really important role to take in that decision as well. But it
the best interest meeting seems like somewhere where they can it's an opportunity for family members to speak as well.
That's correct, yes, and definitely, and to give their views and to be involved in that as well. So that is really important.
Yasmin and Martin, both of you have spoken about the Capacity Act, and there's a process.
Yeah.
One of the things I'm thinking about is sometimes in health conditions, if somebody's had a severe accident or you know you need to make a decision right there and then, how would you follow this process and what would happen in that case?
That's a very good question, and the Act talks about, when we talk about the support and information that people need, we talk about the practicable support. So that does give us a judgment in terms of the urgency of the decision. So for example, if someone's in a road traffic accident and they go into hospital and they lack capacity because of the severe injury they've experienced, the hospital has got no choice but to act upon the situation as they they find it then, because they need to provide that life-sustaining treatment to save that person's life. But if someone's in hospital and the decision is around being discharged from hospital and whether they're going to go home or maybe looking at other options such as residential or nursing care, then we've got a lot more time to take the process, not slowly, but take the process in a way that maximises the potential for that patient to make that decision for themselves. So we can act in emergency situations on the basis of the information that we have in front of us. So it gives us that judgment, because we've always got a duty to act in the best interest of the person. So if we delay a decision while we're going through a convoluted process and the person's health deteriorates or they die, that's clearly not in their best interest. So we need to make that decision there and then in that circumstances as well.
Okay. In terms of patients going to see their GP, I suppose that's pretty clear. Somebody will come and see you. If it has an impact in terms of the Mental Capacity Act, Yasmin, you would mention it to them. In terms of your role and the role of your project, when would you come in, Martin, and how would an individual contact you?
Well, our project is the result of various different reports really into the Mental Capacity Act. The House of Lords did a report into how the Mental Capacity Act was being implemented. The Care Quality Commission also do reports on how they find the Mental Capacity Act as well. And the Chief Executive of NHS England wrote to all the clinical commissioning groups and asked them about the Mental Capacity Act and the deprivation of liberty safeguards as well. And as a response to that, NHS England gave each of the CCGs a small pot of money to try and improve how this was being delivered. And our project is a partnership between 4 local clinical commissioning groups. So that's Solihull CCG,
here in Birmingham,
Solihull CCG, Sandwell and West Birmingham, Birmingham Cross City and Birmingham South Central clinical commissioning group. So our role is to speak to the public as well and our patients about what they understand about the Mental Capacity Act, and we're involved in lots of different awareness raising events with the public to raise the profile of the Mental Capacity Act and to consult them on what their views are. But it's also about partnerships. We're working in partnerships with lots of different organisations. That might be our GPs, it might also be the hospital trusts as well as community providers and residential homes, and it's about trying to achieve best practice in the Mental Capacity Act, so supporting them to give them resources and support to achieve best practice in supporting our patients.
Thank you, and thank you both of you. Really important and interesting topic. It's nearly the time to finish our programme. I know that in a few weeks' time we have got somebody else coming on to speak about the legality and the legal aspect. So our viewers can write in or email me if they've got any questions. But before we finish for today, Yasmin, I wanted to ask if we've got any patients that are watching this program and they've got any of the illnesses that you've mentioned and they're worried, is there any final message that you want to leave for our viewers?
जी हम बस ये कहेंगे कि start thinking now, and जो भी अगर आपको कोई सख्त राय है, your beliefs, अभी बताइए to your friends, to your family, and please come and see your GP. उनको भी बताइए, then they can write it in your record, और फिर होगा if खुद न खास्ता that situation arises.
Thank you. And Martin, same question for you. Is there any final messages that you want to leave for our viewers in terms of the Mental Capacity Act?
I think, yes, it's really important for us to think about the future and to plan ahead. If there are certain decisions that are really important to us, it might be important for us to talk to our family and to our friends about those decisions. And if we want to refuse a specific medical treatment, we might need to consider writing an advance decision. Or if we want to give our family members that ability to make choices on our behalf, then we should consider registering a lasting power of attorney, as that is what's going to give them authority to act on your behalf in those specific situations.
And thank you both for coming onto the Health Matters program. नाज़रीन, ये थे हमारे गेस्ट डॉक्टर यास्मीन अहमद और मार्टिन वॉटसन. इन दोनों ने हमें मेंटल कैपेसिटी एक्ट के बारे में बताया, और आपको याद दिलाती जाऊँ कि अगर आपको कोई और क्वेश्चन है तो आप मुझे ईमेल कर सकते हैं at healthmatters@thenur.tv. लेकिन याद रखिएगा जो इन्होंने कहा, don't leave it too late. अगर आपको कोई शक है और आप अपने मेडिकेशन का, अपनी इलनेस का और अपने डिसीजंस का कंट्रोल लेना चाहते हैं, यू मस्ट एक्ट नाउ। ये मेंटल कैपेसिटी एक्ट के बारे में आप जानकारी लीजिए, अपने जीपी से बात कीजिए, और जो भी ज़िंदगी का कोई पता नहीं है कि कब किसी वक्त आपको कोई ऐसा डिसीजन मेक करना पड़े जिसका आप ना मेक कर सकें किसी वजह से भी, तो आप उसका अभी से तैयारी शुरू करें कि क्या करना है, ताकि जो भी आपका डिसीजन है, जो आपका मन चाहता है, वही हो। इस हफ्ते के लिए नसरीन आपसे लेती है इजाज़त। अल्लाह हाफिज़।